our Q&A session with Geneva College. I want to thank you so much for taking time out of your busy evening to be with us this evening. We know that many of you have a lot of questions that were submitted, and you maybe have thought some of additional questions. And so we're going to try to get through as many of your questions tonight as we go through this time together. But first off, I want to, again, thank you for just being with us. We enjoy having conversation with you, and we want to do our best to answer your questions so we can prepare you and your son and daughter to be part of Geneva community this fall. And so we look forward to this time together. I'm going to open us up with a word of prayer, and then I'm going to turn over to our president, and he's going to talk a little bit. But before I open this up in prayer, let me give a quick introduction to who's here in the room, or on your screen rather. So my name is Anthony Turner. I serve as the VP of Enrollment and Marketing here at the college. We also have Dave Layton and Cheryl Johnston. Dave is our Associate Vice President of Enrollment, and Cheryl Johnston is our Director of Marketing. They're both monitoring the chat function, and so if you've got questions or any concerns, you can chat right there, and then they will respond, and they can get some additional questions to me. We have Dr. Jamie Swank, who is our Dean of Students here at Geneva College. We also have Beth Carlson, who is our Physician Assistant at Geneva, and she is responsible for all medical matters on campus. And we have Dr. Jeff Cole, who serves as our Director of Crossroads and works a lot with our provost and all of our academic matters on campus. And then as well as we have our president, Dr. Troup, who is our president of the college and leads Geneva community. So I'm going to open this up in a word of prayer, and then I'll turn over to him. And let's pray. Father, we do thank you for this time we have together. We thank you for each person here. Lord, we just pray this time together would be helpful as we talk about our current realities and our everyday situation that we live in today. We just thank you for all that you do, and we ask these things in Christ's name. Amen. All right, Dr. Troup.
Thank you, Dr. Turner. I just wanted to welcome you and let you know how much we're looking forward to having people on campus, to have students with us in the fall, and that's coming really quickly now, and we're thankful for that. I want to remind everyone that as we're talking about these good questions that we've received, that we're coming back under COVID-19 conditions, with the priority being to build routines as a community that will help make classes in person possible and a reality for our community. It's our top priority. We really want to be able to meet to the greatest degree in class, face-to-face, in person, and to be able to enjoy some of the things that we enjoy routinely on campus. But because of COVID-19, we have had to put together a variety of plans, and we have a playbook that we use that as conditions change, we're able to exercise flexibility in adjusting what we're doing actually on campus and the degree to which we can be in contact with each other and those kinds of things. So we're actually not trying to get as close as possible to what life would be like without the pandemic. What we're actually trying to do is do the best we can under the circumstances. And that's a real difference for us. We're having to think about everything, and we're glad to do that because the community and the Ministry of Education is so important to us at Geneva College. And so as we respond to the questions, we're responding out of a mindset that begins with the understanding that we need to be flexible and that we need to be charitable with each other through the changes. We ordinarily get to kind of make a decision and set a plan, and then we can stick with that plan for at least a whole semester and often the whole year. But in this case, we're going to have a plan for the starting date, and things will change, we anticipate, even between now and then. Now, we'd like for them to change in a very positive direction. That's what we've been hoping for. This little surge that we've been having is not going in the direction we wanted to be planning for. And so even now, we're having to make adjustments to that. But we're prepared to do that. We have now a good contingency plan in place in a playbook to make those adjustments. So as we provide some responses here, I just want you to know that that's the background. And if you ask, well, could things change over the next month or 2 months or 3 months? We actually expect them to change. We're just not sure exactly what direction they're going to change in or how. Things change unevenly under our current conditions. So we're delighted to have you with us this evening. And we want to provide you with the best information we have today. And then we'll continue to update frequently asked questions, and we'll continue to send out information as it becomes available to us. So Tony, if you could ask us the questions you think we should be responding to, we will be glad to be in conversation.
All right, thank you for that. So we're gonna start with campus-based questions. And so really the first question has to deal with families visiting their son and daughter. And so we know this is really important for families as they're visiting. You know, they want to visit their son and daughter and see how they're doing. So the question is, we would normally visit, travel to campus 2 or 3 times a year from North Carolina. And the son, my son or daughter would stay with me in a hotel during that time period. Is that something that you would advise that we should continue doing? Should we discontinue that? How should we deal with that going forward?
Thanks, Tony, for that question. There are 2 parts to this question. And the one part has to do with, we all know that these days, where you're coming from is an important question. And so how to deal with that in a campus visit kind of context, parents coming to visit their students, is a really important question. But let me talk about the visit protocol in general. Do we want parents to be able to come and visit their students? The answer to that is yes. Do we want parents to be able to come and be on campus? The answer to that is also yes, as long as people are physically distanced and taking the appropriate measures that the college has established. What we would like people to think about in terms of modifications is maybe not come quite as frequently, but secondly, also not go into college buildings. We're not going to be able to have a lot of gathering activities on campus, but there are lots of good things that people could do on a visit. So for example, staying at the Microtel in Chippewa Township and going out for a meal if restaurants are open and serving in that kind of way. We would think that, for example, spending time with your student, but not necessarily being in close proximity to their roommates or friends would be an important thing, being really careful about maintaining distance in those kinds of ways. We know how important those kind of contacts with our children are. As a father and a grandfather, I cherish those times, and we think those things are important. We just need to do them a little bit differently and with greater care than we might under different circumstances.
That's really great. And a kind of a follow-up to that is if you have families who are coming to visit campus, what about?
Sorry.
Let's try that now. Okay. Very good. So, that's a really good response. So I have a follow-up question to that. What about students visiting their families? So they want to leave campus and they want to go visit their family for the weekend during the fall semester. Is this a mandate or suggestion? Because we've kind of talked about we're not recommending that students visit home during the weekend. So is that a guideline, is a mandate? And what if they're local? Do we have a set radius or miles that we would allow exceptions to occur? Any thoughts on that?
As we're thinking about this kind of travel, what we want to think about is what kind of basic practices and routines are we trying to establish? And so I think the first and most important thing to say is that there are some really important reasons why someone might need to go home for a weekend. There are certain kinds of family events, for example, weddings, other kinds of significant events in a family's life, and those don't happen 10 times during the semester, right? And so if there's a compelling family reason for a student to go home on the weekend, obviously we think that that's okay. And usually those kinds of things are either planned things or things that emerge where there's a really compelling reason to do that. What we're trying to do is to keep people on campus and in the community as much as possible. And to accomplish that means, as we said with visits, limiting frequency. And so the idea of going home and taking my roommates home, which I did when I was at Geneva, and hanging out at home because it was a great place to hang out, that's what we would encourage people to try to do, that hanging out on campus for the most part. And then if there's a compelling reason to go home, we're not anxious to set up a mileage distance. I mean, all you have to do is think a little bit about the fact that we have faculty members and staff members who commute to campus and that kind of thing. But to do that, we're following pretty strict and careful guidelines as we come and go. Regular screenings and that sort of thing. So we don't want to put ourselves in a situation where we say, oh, well, it's okay for faculty and staff to drive 30 minutes to go home and back every day. And students can't do that. On the other hand, the greater the ability to keep people in place and with the people that they're with most of the time during the semester is really the goal of that. And so limiting weekend trips home is what we were talking about and what we want people to work at. But there are good reasons and exceptional circumstances why on an occasion we would be supportive of someone going home and then taking great care when they're in a different environment than the campus environment.
Great. So I think the one question that's on many parents' minds is probably move-in day. I know for many parents, the thought of dropping off their son and daughter, whether it's their first one or their last one, it's a really special time. And we know that due to COVID, things are going to be different. So what does that process look like? Will parents be able to come and help their son or daughter move in to campus this year? And will you be letting us know about what the procedures and protocols of that would look like?
Yeah, I can take that one. So we, due to kind of the changing circumstances surrounding COVID, recently with some new guidance in Pennsylvania, we've had to adjust some of our move-in protocols. So we are hoping to get more detailed instructions out Monday to incoming students and returning students. Typically we like to get that out earlier, but we wanted to make sure that when we send what we sent out, people could rely on to make plans moving forward. And since things have been changing, we've had to adjust a few times. At this time, unfortunately, to preserve the ability to have folks on campus and to ensure that we make the transition with everybody coming from different parts of the country nationally to campus. At this time, we're asking parents not to be in the residence halls on move-in day. That said, we have a process set up that'll be pretty easy for parents to come up to the hall, drive up to the hall, unload the car. We're going to have lots of really excited upperclassmen in a contactless way that will help get those belongings up to the room. We're going to have upperclassmen students that can make sure that there's help to bunk beds and to do those things that I know parents often worry about and want to make sure that their son or daughter has that support when they move in. But let me say this, having done this work for a while, I know that is, that's a point of grief for a lot of parents, and we want to acknowledge that. We don't make that decision lightly. It's something that we wrestled with, but with Pennsylvania now asking for folks from multiple states to quarantine when they come into the state of Pennsylvania, and for that list to be continually changing, and wanting to make sure that these first few weeks that are really important for us, that we do these first few weeks really well in getting folks in, making sure folks stay healthy, that folks learn the protocols and the systems. We felt it was best to try to limit any incidental exposure as possible. With that said, we're going to make sure they have plenty of help. We're also going to have some options for parents that are going to be set up on move-in day. More to come on that. We'll be communicating so that we can get you connected as best we can. And then hopefully this will pass us by soon and we can get you all on up here and you can see the space and be familiar with it. If you have questions about layouts of rooms or things like that, those things are on our website. But if there's some information that would be really helpful for you in your planning that you are hoping, hey, once we get there, we'll see the room and we'll just let us know. We'll be happy to get you whatever you need. And make sure that you have the measurements of the room or anything that would be helpful if you're purchasing a rug or something like that. We can make sure that happens. So more to come on that, but right now that's one, to honor our state officials as well as to ensure that we have a healthy start. We felt like that was an important decision for us right now. So.
Thanks, Jamie. I have a follow-up question, and maybe Jamie or Beth, you might be able to answer this question. Related to parents visiting campus or coming from different states, what do we do with students or even parents that are coming from Florida or from one of those hot spots that the Pennsylvania has designated? Should they be trying to quarantine or test in their state before coming to campus, or can we clarify, what responsibilities does the student have or the family have prior to coming to campus?
I can kick us off and then I'll let the expert speak more directly. Here's the thing is that I think it's challenging for sure, but we all have the same goal. You have the goal that your son or daughter comes to campus and has a good classroom experience in a healthy fall semester, and that's our goal as well. And so at this point, anything that a family can do to ensure that is helpful to us. And so if a family's traveling, if the student's quarantined, but mom and dad are in the car driving from Florida, and they haven't been quarantined, then obviously there's the chance for exposure. And so risk increases. And so anything that a family can do to limit exposure to, if the option is there, we know not all families have it, but if the option is to work from home during that period where the son or daughter is quarantining or limiting access, that's going to be really helpful, not just to us as a community, but to your son or daughter, because the healthier our community is, the healthier your son or daughter's experience is going to be. So obviously we don't have the ability to mandate that, nor would that necessarily be our place. But if families are saying, hey, how do we do this well, partnering with us in that, not just with the student, but with the family around that student, is going to be a win for everybody. So Beth, I don't know if you want to speak to that more.
Yes, given the mandates that we have here in the state of Pennsylvania from our Department of Health, anything you can do as a family unit to keep your student healthy and at least amount of risk while you're traveling, or even for the 2 weeks prior to them reporting on campus, would be greatly appreciated. There is testing. I say that very gingerly because there's not easy accessibility to testing. That would have been the easy answer, but because of the hotspots all over the United States now, testing is at a premium and it's very hard to get. Plus, the results aren't coming back very rapidly. So quarantining is your best bet. And that means, and I know that's hard, they might want to see their high school friends before they go, but this is a different world we're living in, unfortunately, right now. And just our goal is to keep them healthy. The community at Geneva to keep healthy. It's a huge goal of mine. It's a huge weight on my shoulders, and any help I can get from all of you folks would be greatly appreciated.
Thank you. So another question related to move-in day. So we talked a little bit about some of the procedures. You know, there's a question from a parent. Can at least one parent go in the dorm on move-in day with a mask?
We're asking that no parents are in the halls, and the reason for that is there's a lot of moving parts on move-in day. There's a lot of stuff. There's a lot of people moving in multiple directions. I'm sure most of y'all have been in a residence hall at some time, and so hallways tend to be pretty straightforward. Windows are in the rooms, and so it's really important for us that we have a very disciplined way of moving people in and out. And we're going to be staggering when folks come and all of that. So right now we're asking that no parents are in the building on move-in day.
Okay. So when it comes to more of, you know, health-related pieces of COVID, if a student becomes sick or, you know, becomes ill with COVID, can you kind of explain what our procedure is on campus? Will she or he be required to quarantine on campus, or will they be required to return home? What is our framework for that?
Jamie, do you want me to start on this one? So as far as if a student becomes sick with COVID type symptoms, they will be assessed by the health services virtually, obviously. And we will recommend testing. That's the best way we can make sure that we don't get the entire community ill. Based upon whether the test comes back positive, then the student needs to isolate. Ideally, we want them to quarantine if they are, well, we're going to require them to quarantine if they are symptomatic. And we do have a quarantine and isolation protocol, which I will defer to Dean Swank, you know, to go into more detail. But we will not make the student stay on campus. If you want your student at home in quarantine, we highly encourage that your student go home in quarantine, because we are very limited in our spaces for quarantine isolation. And there are students that live across the country, and if they're positive with COVID, I'm not putting them on a jet and sending them across the country with COVID. So they're going to have to quarantine and isolate on campus. But we do have quarantine protocols. The health services will be checking in on those students, as will residents' life. So they won't be stuck in a room with no contact with anybody. And, you know, we have the whole plan set up, and we just are praying we have to use it very rarely.
Yeah, from the student's perspective, it'll be pretty simple. We will be making sure every student, and most students already, returning students, would have our on-call staff number. That'll be posted in classrooms. It'll be posted around campus. So if somebody begins to feel symptomatic or feels as though they might have been exposed to somebody, or they learn of that, we're going to be communicating to them that we want them to call that number as soon as they're aware of either of those things. We're going to have staff members on the other end, around the clock, 24-hour on call, who are trained to kind of lead them through the protocols. We will be using the CDC questionnaire as a kind of helping them work through the symptoms and getting the information that we need so that we can respond. As Beth said, we have housing for quarantine and isolation prepared and our protocols for that, both in cleaning, food delivery, laundry. We have all of those protocols worked out so that the student knows exactly what to do, and we'll be able to coach them in that. We'll take care of getting them into quarantine or isolation, or if they, our preference is going to be if they can go home, that they do, because that's going to be probably more comfortable and ideal for them in many ways to have family around. But also, to what Beth said, there are some students who won't have that option. And so we want to do our best to maximize that space as much as we can. And then once they're settled in, the next business day, the next morning, health services will reach out to them and begin to work them through next steps, testing options, what that looks like, monitoring symptoms, all of that. In addition, my team will be getting in touch with faculty, coaches, and any on-campus employers, and letting those folks know that the student is, we won't go into the why, but we will let them know that that student will be out of class or out of work for an X amount of time, likely at least 14 days. And so all of our faculty, and I'm sure we'll get to this in a little bit more detail, but we are prepared for them to do their coursework remotely while in quarantine. The faculty have been working incredibly hard this summer on that. And so Beth will kind of be letting us know and connecting her and her team with that student. And once that student has had the appropriate negative test results in the period of time, or they remain asymptomatic for the right amount of time, Beth will let us know, and then we'll get that student back on campus and back in class as quickly as we can. But we're pretty confident in our students and in our faculty and staff that we can make that experience. Obviously, it's not going to be comfortable to be quarantined, but we're going to do our best to make that as easy as we can. And I think we're prepared to do that.
Thank you. So we talked quite a bit about isolation and the procedures we're taking. So related to that, what does resident life, the resident hall life experience look like with all these changes that are happening? And on top of that, food service, like the dining hall. So what are the measures, what are the changes that are going to happen this fall in regards to those two areas with resident life and just accessing everyday, meals in the dining hall?
All right, I guess that's me again. So sorry for y'all having to, we'll get you some variety here in a minute. So I'll start with the dining hall. Obviously, we are working our protocols through what the state is asking of us at this time. And so right now, Pennsylvania is at a 25% dining rule. And we have some limitations on how many people can be indoors, gathered in an event, which is 25 right now. There's an exception for instruction right now in Pennsylvania, so that is good for us as far as being able to maintain our academics to the level that we want to. But dining is one of those things that, at least in the immediate, is impacted by where we're at with state guidance. So a couple of things. One is that the way students move through the cafeteria will be different. And hopefully we'll be back to normal sooner than later. But for now, we have to make sure students come in one way and out. And so the kind of moving around the cafeteria, grabbing from the station, grabbing from this one, we're going to have to do that a little bit different. That said, we're able to maintain our options in the cafeteria well, but they'll be served. It won't be buffet style. So there'll be plexiglass. Students will have to have masks on when they're moving in and around the cafeteria. Once they're seated, they obviously can take the mask off to eat. We're also, because of the way that the cafeteria needs to function and seating needing to be socially distanced. We're going to have some large tents set up outside with outdoor seating and other places for students to grab a meal and hang out and kind of linger as you need to have that break midday between classes for sure. Or breakfast. A lot of times folks come up and grab breakfast and do devotions or study the word and stuff like that in the morning. So we want to make sure there's plenty of space around. The space is just going to look different as to where folks land. And I don't know, Jeff or Beth, if there's other stuff there that you want to throw in, please feel free. So it won't be self-service. It won't be kind of free-flowing, but you can go back and get seconds. It's no problem. Just kind of, we'll be moving in one line in and around. So you'll go in one station, and then you'll come back out, there's different lines to different food options. And so, and similar for our brig, which is our smaller grill down in the student center. At this time too, we'll also be limiting initially outside guests and faculty and staff eating in the dining hall to make sure that there's priority given to students so that they can get in during the meal times and get what they need. For those of you that may be familiar with Geneva, we love to break bread together. That's the sacred thing here. And a big part of who we are is having meals with students. And one of the things that blesses my heart really deeply is the amount of faculty that you'll see having a meal with a student and building relationship and staff discipling students over meals. And we're going to get back to there. It's a priority for us. We're excited about that. But we just want to make sure we start well, start safely, get everybody in, get everybody comfortable with the way that we're moving. And then as our state guidance changes, we'll be able to adjust accordingly. So I don't know if that answers the dining hall question.
Yeah, very good. And just in case from everyone out there that's listening, if you have follow-up questions and we don't answer them this evening, please email us at information@geneva.edu, and we'll get a response back to you. And so I don't want you to feel that, oh, we didn't answer your question. Please use that as another way to ask your questions, and we'll get a response back to you. So continue on the phase of just with COVID and life. Dr. Troup, you mentioned that Geneva will be participating in the Mayo Clinic study. Is that participation in that COVID study mandatory or is it voluntary? And can you tell us a little bit about it?
Yeah, let me start by talking in broad terms, and then I want to turn it over to Beth Carlson to supply some of the more detail. As people know, I think by now, we are paying very close attention to written guidelines and to understanding what the Pennsylvania Department of Health and Education and what the CDC says, what the American ACHA, what is that? American College Health Association.
Correct.
And a number of these groups, and they're all working from similar perspectives in terms of what we understand about pandemics and how to manage them, but they provide different angles on things that are helpful. But we also have our COVID-19 Advisory Council, and a number of the members of that council are Geneva alums, and so we have a family practitioner who specializes in public health and infectious disease and actually leads some of the infectious disease work at Penn State University Park. He's a teaching fellow at Penn State Medical Center in Hershey. We have an alum who studied epidemiology and did a master's at Johns Hopkins and has worked in public health. She's also a homeschooling mom with 4 children right now, so she's doing some consulting work, but is a full-time educator as well. We have an alum who's at Brigham Women's Hospital in Boston and is a fellow of the Harvard Medical School, and she's in pathology and works on these issues leading Brigham Women's Hospital and how they're dealing with COVID-19 issues. We also have a friend of the college. He's not an alum, but he is a distinguished researcher of infectious diseases at the Mayo Clinic. And so we've had this opportunity to participate in a Mayo Clinic study. And any kind of research study like this is always voluntary. It's part of the research protocol that it has to be voluntary. And so this is not mandated. It's voluntary participation. That said, it's a huge value to our community to have the highest possible participation that we can, because it will actually help us understand the COVID-19 landscape in the Geneva community very specifically. And Beth can explain how the study works and what will actually happen and what's going on medically with it. But we're gonna all be participating. It's a pinprick twice in 6 weeks or something like that is essentially what's involved in. And given what most of us have been through in our lives, sitting through certain classes is less painful than a pinprick. So Beth, if you could explain how it works and what we're hoping that people will be willing to join us in doing.
Absolutely. As you can tell, I'm extremely excited about this program, and I would hope that I can encourage others to be just as excited. We are very blessed to be able to be part of this program and this study. It is voluntary, as Dr. Troup said, and it is extremely low risk. The only risk is if you're willing to poke yourself in the finger and get a couple drops of blood on a card. It's like the old-fashioned blood typing cards we used to do in biology labs. But the testing is actually being donated by a major company for us to do this. And that's huge, because if you wanted to go get COVID antibody testing today, you'd probably have to pay $70 for it. So this will be free, and your student can do it for free. It's open to our faculty and staff. The test actually is testing for both of the COVID antibodies, the IgM, which is the acute response to COVID when somebody is acutely ill and symptomatic. And then it's also testing for the IgG antibody, which is the memory antibody. And that's the big one you're hearing about on the news is, are we keeping our immunity? Is this going to last? But this is what we need to do. But the great part is they're also going to test it for influenza A and B, which are our flus, RSV, which is another type of respiratory virus we use, respiratory syncytial virus, and it's going to test for the seasonal coronaviruses. Now, not to confuse you and alarm you, we've always tested for these when we do viral studies in the lab. So they're all part of it, and it's all voluntary, very low risk, but extremely important to your student. They'll find out if they've maybe had asymptomatic COVID, which is very common in this age group. And it'll also let us know where our students stand for the community going in. So the study is, we ideally want them to do the pinprick within the first week that they're on campus. It is self-addressed stamp mailer back to the company. We do not get the students' results individually. The student will get their results, but Geneva will not. Our results will only be aggregate results when the study's over. And then we're going to ask them to complete the study again in 4 to 6 weeks. Exact same protocol, everything, voluntary, low risk, and they pinprick themselves again and send it out to the company. And they'll find out if they may have contracted COVID, hopefully not, while they're at Geneva or someplace in the community between that, 5-week time period. The contribution, and we as stewards to the community here at Geneva, as students and the community here in Beaver County, it's just tremendous what kind of information we'll be able to get from this. You hear folks talk about herd immunity. We're a long way from herd immunity in America, let me tell you that right now. But this will help us in helping determine some of this stuff. So I'm doing it. My family's guinea pigs on the test kits next week. They all have to get stuck and they want to find out if the kits are working and everything. But like I said, it's voluntary, but please encourage your students to do it. It's a wonderful opportunity that we've been given.
Thanks, Beth. I think I have a follow-up question with the testing. So we have this Mayo Clinic testing that will be happening on campus But where do students find the COVID-19 screening test, and where would they submit? Where do we have to submit the results of that to?
Sure. So the COVID screening test, every student, faculty, staff, and any visitor that comes on campus once we start, well, we're doing it all now, but if you're on campus, you're going to do this COVID screening test. It is found on the My Geneva webpage. It'll be linked there. All they'll do is complete it every single day. I will repeat that. They need to do the COVID questionnaire every day. And this is common. Almost every employer that I know and everybody in PA is doing this. They don't have to worry about sending it anywhere. It automatically goes to student development. And the results will also, if they're symptomatic, if they answered yes to those, they'll be given instructions to call the on-call person and go over this with them. Again, this is to help us with the whole quarantine type of, protocol. And then we in health services will be following up on that with the questionnaire once they've completed it. But it's very simple. They just go to My Geneva, complete the questionnaire, and it goes to where it needs to go.
And we're working right now because in the fullness, especially for new students, there's so much to digest those first few weeks getting acclimated that our tech services team is working on making it so that students will get a text every day prompting them to do the short questionnaire. And so that'll be helpful, I think, for students as they're navigating, getting their classes and meeting new people and getting adjusted to college life. So we're trying really hard to make it as seamless as possible. So
I just want to mention that it's simple enough that Dr. Troup can do it at early in the morning before I'm completely awake. I was 97.7 this morning, and it's on my phone, and it's easy to do. And so you just we talk about routines, but this is what it takes in a pandemic. We just have to build the routine, and you get up and you do the thing, and you don't have to like doing it, but it doesn't take very long. And pretty soon it's just a regular thing, and it's really helpful to the community.
Great. So this question's similar and somewhat similar to the daily screening test. So we're talking about resident students. What about commuter students? Students who are going to commute in and out of campus on a daily basis. What's it going to look like for them for the screening tests? And just can commuter students hang out with friends on campus? And so I know it's a two-part question. So it's more of the screening, but then also how's commuter life going to look like on campus?
Swank, I'll start about the screening, and then you can discuss that. As I said before, commuters will also do the screening questionnaire. Every single person who comes on Geneva's campus will do the questionnaire. That is how we are going to try to mitigate the spread of COVID. It's super easy. And as Dean Swank said, IT has been working diligently to make this as easy for the students as possible. They can pull it up on their phone, and that's how simple it's going to be. And as we mentioned with Dr. Troup taking his temperature, we are requesting that every student bring a thermometer with them. We do want temperatures in the morning too. Plus, we need to know, if they're having symptoms. That's one of the first things I'm going to ask you. Do you have a fever? I need you to take your temperature. So thermometers are going to be really important. And then for the commuters on campus, I'll turn it over to Dean Swank.
Yeah, it's a great question. And in many ways, as to what Beth just spoke to, the protocols are similar. And we will be asking of them to use the same wisdom that we'll be asking of our resident students as how they move and how they engage when they're not in class, to be wise and to be practicing social distancing and masking and taking the preventative measures that we're asking of all of our community, faculty, and staff included. And so with that, at least to start, again, as Dr. Troup said at the beginning, a lot of this will evolve as guidance changes, as the virus, Lord willing, starts to dissipate and numbers start to go down. So I think it's important to remember that these things aren't set in stone. This is where we're at right now, and we'll take it one step at a time. But as we get started, the commuter students obviously on campus. We want them integrated into the community. We want them using the library and studying in Sky Lounge. And if they have a meal plan, we really would love for them to have a meal plan and to be grabbing food with their classmates. The one thing that we're trying to do right now is just with the residence halls. So typically commuter students would have access to the residence halls, but because there's, especially in the evenings, there could be a lot of people in the residence halls moving around. It's a little bit more close quarters. We felt like it just made sense for us to not give access to commuter students to the residence halls initially. And then as things improve, we will open that up. Because the way the furniture is set up in common spaces around campus, it's socially distanced, it's moved away to the, kind of 6 feet distance where we have capacities, limits on certain areas so that folks can hang out and linger and socialize safely. And so we want to make sure that our commuters, once you're in the residence halls and in somebody's room, we're treating those as households. And so that's where we're kind of asking for that separation, at least to start. So as a student would go home to their household, the residence halls we're treating as a resident student's household. And so I felt like I might be fumbled that one a little bit. I don't know if that answered the question.
I think we
should have had that second cup of coffee. That's what I should have had.
That's right. I'll send you some.
All right. I'm gonna hold you to it.
Yeah. So you said a couple of things there, Dean Swank and Dr. Carlson. So just to follow up, so one, you talked about masking. So what kind of face coverings should students have? Are they going to be required? Do they really need to wear it? And then another question related to what you mentioned earlier was, do students need to bring their own thermometers and to do their own tests?
So yeah, about the face mask or face covering, as we're calling it, is a requirement that is mandated by the State Department of Health and our governor in Pennsylvania in all public places. So especially anywhere you cannot maintain 6 foot social distancing, there is all the information you want about face masks on Geneva on the www.geneva.edu webpage, and it tells you how to wear them, what kind you can wear, what kind you should not wear. And if you're wearing it, it needs to cover your nose and your mouth, not here. Face shields are allowed too. And that's why I'm not just saying it's face mask. It can be a face covering, and they are going to be required. I'll let Dean Swank talk about how they are in the residence halls, but face masks need to be, and I would encourage all students to bring their face masks with them. They are to be cloth face masks. We still cannot get the PPE face masks we need in healthcare. So we want to reserve the surgery mask and the N95s. That is not needed. It's to be a cloth face mask. And the CDC recommends it be 2-ply of cotton. So, or if you buy the plastic face shield, that's okay. But all the information you'd want to answer that question is also found on our website. We have a great mock-up of pictures and everything for it. Oh, thermometer, sorry. Yes, we do need you to bring your thermometer. Obviously, thermometers, hopefully you can, the reason we want you to bring your own thermometer is you can purchase an oral thermometer very easily. They're not hard to find. It's the digital ones and the infrared that are very, high in demand that we aren't able to get. But we don't want people sharing thermometers. So we would like every student to have their own oral thermometer, please.
Thank you. So we've got about 10 minutes or so, and I want to make sure that we get to some of the other questions in terms of academics and extracurricular. And so one question in regards to academics is Geneva prepared well to make a switch from residential to online? Again, if it needs to happen before the semester ends, we had to make a transition fairly quickly in the spring. So how is the college prepared to do that if that should happen again?
Yeah, so Tony, I can address that. Dr. Melinda Stevens, who's our provost, has directed the faculty to plan for what she calls nimble instruction for the fall. So of course, in-person instruction is our desire, but we recognize that there will be students who are going to be quarantined or who may become ill. And so faculty members are creating flexible course plans for each of their classes that take into account students who are unable to attend class because they're quarantined or they're sick. And so this nimble approach will allow students to continue their coursework uninterrupted until they can return to class. And also this approach will serve us well if we have to move to virtual instruction, total virtual instruction, as we did in the spring semester. So our goal as a faculty and as a college is to make that transition seamless. And I have to give a shout out to our instructional technology services department, because they've been working like crazy to make sure that not only is our infrastructure right, but also that faculty have the hardware and software that they need to serve students well, in whether we're in the classroom or not in the classroom, or whether we're in a hybrid situation. You might be interested to know, I think this is worth saying, that the faculty just completed 5 weeks of training in such areas as designing flexible curricula and best practices in pedagogy and assessment and training in new software programs. And that's really rooted in a survey that our provost did in May. So in May, Dr. Stevens sent out a survey to students, our current students, and said, hey, what worked well? And what can we improve on? And so she used those results then to inform our training as faculty members. And so the goal then is to continue strengthening what went well in the spring and address areas where there were weaknesses. And really, student feedback was very helpful in this regard. And one thing was clear, and I really want to be heard on this, and that is both in the formal survey and in conversations that I and many other faculty and staff had with students, is that our students want to be on campus. And that reflects the desire of our faculty and our staff, the institution generally. We want our students to be on campus. We place a high value on in-person instruction. So that's why there's so many people working very diligently to make on-campus instruction a reality this fall. And that's why we all need to do our part to make sure that we keep our campus healthy as well.
Great, thank you. So part of the college experience is obviously going to class and and interacting with professors and doing hours of homework in the library. But then also there's fun aspects of a college education, such as playing athletics and intramurals and clubs. And so, can we talk a little bit about this? This might be several people, but talk a little bit about what is fall, sports, either interscholastically or intramurals and clubs. What is that aspect of co-curricular activity look like for the fall?
I'll start out and then let others follow on this. I think the first thing that we need to understand is it's going to be limited. So we want students to be able to be active and involved together. And it's really important that we do those things and that we do them with care. For example, the stories that college presidents and other people in college experience here about where there are outbreaks of COVID has to do with contexts where people, not just college students, but anytime people decide to take a day off and they say, I just can't bear the burden of this anymore. And so they avoid the measures that they had been taking and get in really close proximity for a long period of time and hang out the way we used to. And one of the examples, because I played football in college, that happened at Ohio State University. And one evening, 2 different groups of football players got together and hung out. And 2 weeks later, they had over 20 members of their team, student athletes, who had come down with COVID-19. And so it's actually really good for people to be involved in activities on campus and to be involved in what we're able to do with sports. Because when we do those things together, we can have that kind of discipline and take care. What we want to avoid is informal gatherings that happen in other contexts where people get the impression that they're not susceptible and set aside those kinds of things. I heard a story, I'll tell a story on people in their 40s that I heard yesterday. I was in a meeting and the person leading the meeting, it was a small group meeting, and we were talking about these issues, and they said, you know, there were professional friends of theirs that had been working really hard to observe things, and then they got together and had one evening where they played cards together and played poker for an evening, just 4 of them. And all 4 of them contracted COVID-19 from that one night's experience, and 2 of them passed away and 2 of them are hospitalized. And so this is not a generational thing. This happens to people in every generational category. So we really want to have activities, and we're going to do the most that we can. And we want people involved in the activities, because when we're doing those things together as a community, we maintain distance, physical distance. We'll encourage each other to participate in the measures we need to take, but still I'm much more excited about talking about physical distancing, because we don't want social distance. We want conversation and interaction and fun, and we can do those kinds of things at a distance. And so we'll go forward with activities as we're able. It's a very rapidly changing landscape in terms of college sports and what we can do with intramurals. And so I can't tell you exactly where we're going to be in 4 weeks. But we're going to be doing as much as we're able to do safely, and we're going to be finding new things to do that we can do safely, so that we can continue to have an active on-campus level of activity. As was mentioned, we're buying tents, permanent ones that are well made and big, so that we can spend more time outside. So I'd make sure to make sure that you bring good outdoor clothing, because it's safer outdoors, and we want people to be able to interact and talk together and eat together and do those kinds of things that we cherish at Geneva College.
So we probably have time for maybe one more question. This hour has flown by. So in terms of just some communication, and so, you know, we've been sending out a lot of information. There's information on our website about the COVID, and just different newsletters have gone out. And so will there be specific and detailed information on a regular basis communicated to students? And then how will that occur? And then with just some scheduled things, you know, how will that be handled this fall?
I'll just start by saying we have been working really hard to send out regular communication. And here is the challenge that we face. We want to make sure that we send messages regularly, but we also don't want to pile on in terms of having massive numbers of emails and texts and those kinds of things. And so Dean Swank and Provost Stevens have been working with our marketing and public relations office to send out FYI notices. And she'll talk about that a little bit. But there are key things that people need to keep their eyes out for, because there's so much communication going on from so many different people, that it's easy for people to miss things that we have sent out. But people need to know that all of the prime things that have to do with calendar and activities and changes are in the FYIs. So Dean Swank, can you just talk about what's going on with that?
Yeah, absolutely. That's kind of been one of the, I don't want to say wins in the season, because the season's been hard for everybody. But one of the things we learned, maybe that's a better way of saying it, was that weekly communication was really helpful. Not just for students, but we sent students, we had a separate one for parents and a separate one for families, or excuse me, alumni. And so we were sending those out weekly. Right now we're sending those out bi-monthly. And in those are any announcements, updates, there's articles, there's a lot of resources at the bottom, student support resources out at the bottom and everyone. And we're looking to continue that moving forward because it's been received very well. One of the things that is really helpful if you're a parent is to make sure that we have your email address. Sometimes we'll get student information, but making sure we have up-to-date parent information, we can make sure that parents get that parent newsletter. The other thing that I would say as far as communication, especially once school starts, is helping your student understand the importance of checking and keeping up on their email. Email is not the main mode of communication. Generationally, that's text message or Snapchat or those types of things. But professionally, email is still the main mode of communication. And so one of the things that we learned coming out of moving very rapidly to an online format is that students aren't used to a professional way of managing an inbox the way that us old fogies are. And so one thing that can be helpful if a student is frustrated that something's not been communicated to them or they feel out of the loop, it's very possible that it was communicated and it's somewhere in their email. And so asking them and getting them in the habit of checking that. There's probably a lot of information that's even there now. I had a sibling, I'll throw him under the bus because he's not here. He went to a different college, so we'll throw him under the bus. But my mom would say to me, I'm the oldest, I don't understand, like, your school always communicated with you. Why does his school never communicate anything? And I said, well, I'm not sure it's the school. And here, everything was in his email, he just never checked it. And so it was causing frustration for my mom because, you know, she didn't have what she needed because they're an adult. And so we're going to communicate to them. And so if there's things that you're not getting, it's probably good to ask them if they checked their email recently.
So what days do those come? Because we set it up so that the student FYI went out on very specific days so they could count on it being in their inbox, and same with parents. We sent parents on a specific day.
Yeah, I don't know that we have nailed down the specific dates and rhythms for the fall. But my understanding is that we're going to continue. Right now, like I said, it's bi-monthly, so I think we'll be deciding whether the bi-monthly is sufficient for the fall or if we'll go to weekly, back to weekly. And we will communicate in that first one that goes out the schedule of when to expect it, whether that's every Monday or every Tuesday. But it will be the same day that it comes out, so you can look for it on, every Tuesday. So. But I mean, I don't know if Cheryl, if you have more on that, if you're with us, Cheryl sets our rhythms for us as the director of marketing and PR. So, but we will be making sure folks know when to expect it.
Yeah, currently that.
And I've been so quiet here, Jamie. The student FYIs go out on Tuesday, and the parent FYIs go out on Thursday. So hopefully you found them. And if parents would like to share their email address, please do that. An easy way to do it is to send it to information@geneva.edu. So thanks for asking, Jamie.
Yeah, and the only other thing I would say about communication, when we've not touched on this, and then Tony, you can boot me off, get the cane and get the hook and pull me off, is that we do have an emergency text system. So as long as your student hasn't opted out of that, anything that is that urgent or serious, we have the ability to email and text students immediately. And so if there was something that was super urgent, we can get that communication out to our campus community very fast. So.
Great. Well, it is 7:05, and I'm sure we could spend another 2 hours just answering questions. So I want to first of all thank our panelists here. And during my questioning, it was not meant to be an interrogation at all, but they did a good job. And thank you as parents and some students on the line. We thank you for sending us your questions. Thank you for being part of this tonight. We know that, you have a lot of things that you're wrestling with and wanting to be on campus, and parents, want to make sure that, everything's in order. So as has been mentioned, you know, we're working very diligently on these things, and we always have updates, you know, that will be sent out, as well as our website. And so we just want to say thank you. Thank you for being with us tonight. That really means a lot to us. And so if you have follow-up questions or concerns, or, you know, you're not really sure, again, use that email address at information@geneva.edu. So you can definitely email your questions there. For many of you, you still might have contact with your admissions counselor. So you can always reach out to your admissions counselor, and then we can, you know, follow it that way. And so we want to be responsive to you. We know that we're all walking in this situation together. All of us have never experienced something like this, so we're doing this together. And so please don't be bashful. Just please ask questions. We want to give you answers, and we'd rather give you too much information than not enough information. And so thank you, and we look forward to seeing many of you on campus here in the next month or so. And we wish all of you have a great evening. Thank you.